Good morning, everyone. Welcome back. 7:40 now on your Sunday morning. Many women suffer from irregular menstrual cycles and don't know what options they have for them out there, but there are lots of options. That's the good news. And here to talk to us this morning about it is Dr. Allison Devine from the Austin Diagnostic Clinic. Thank you so much for being here with us this morning.
Thank you.
How many women have this problem?
This affects about 1% of women. Any woman that has irregular menses, and it's a problem that's going on for at least 3 months or 3 menstrual cycles, needs to have an evaluation for the cause.
Does it have anything to do with age or whether or not you've had children?
Well, premature ovarian insufficiency is declining ovarian function or cessation of ovarian function in women under the age of 40.
Okay. So how do you treat it? I mean, how do you know what the symptoms are besides just not having a regular menstrual cycle over 3 months?
Generally, if you start to have that problem, you need to see your doctor to have an evaluation. And generally, we can work it up with a basic hormonal evaluation, which includes checking your FSH, or follicle stimulating hormone, and your estradiol level. If your FSH is elevated in the menopausal range or your estradiol level is low, then that's usually consistent with the diagnosis.
Now, some people have had regular menstrual cycles for all their life, and then suddenly it changes. So what causes the change? What happens in you?
Sometimes it can be just a very transient problem. Stressors, lifestyle changes can transiently change the menstrual cycle. But if it's ongoing, then it can be either an anatomical problem or a hormonal issue, and that can be affected by your thyroid function, your pituitary function, or a primary ovarian cause.
And what's anatomical? What exactly does that mean?
Anatomical is something actually within the uterus, whether it's a polyp, which is an overgrowth of tissue, or something like a fibroid, which is a benign overgrowth of the muscle. Things like that can cause irregular bleeding as well.
And do you have a greater chance of having an issue if you've had children or if you haven't had children? Does it matter?
That doesn't necessarily affect whether or not you're going to have ovarian failure prematurely in the future. Some things that could increase the risk are certain exposures to toxins such as chemotherapy or radiation therapy. Some other medical conditions that can reflect an autoimmune problem such as hypothyroidism or adrenal insufficiency can also be red flags. But 90% of the time, this is just a problem that develops without any known cause.
Well, thank you so much for being here. That's been very interesting. And lots of people who suffer from it don't even know that there is really a problem.
Yeah.
So if you need more information on how to find Dr. Devine, you can go, just look right here. It's ADC Obstetrics and Gynecology, and there's the number 901-4013. And you can also go to their website for more information at adclinic.com. Thank you again for being here, Dr. Devine. We are